This video is just to demonstrate massage of the scar after a total knee replacement operation. The scar is usually located just above the kneecap and usually finishes off with the incision just below nearer the tibial tuberosity here. The scar can become very furred and thick with scar tissue, which can prevent bending of the knee. A simple solution to this is just massage over the scar. So what you want to do is just take a moisturising cream, just put a little bit over a couple of fingers, and then what you want to do is spend 5 or 10 minutes just going up and down the scar. So you just want to go top to bottom and back up, and nothing too technical, just going round in circles. And this will have the effect of improving the cosmetic appearance of the scar and also soften the scar tissue, which can often bunch up underneath the skin. So as stated, it really helps just to do this about once a day and for periods of 5, 10 or even 20 minutes if you find it really helps. Often this will help to increase the bend of the knee after you've done it, and you can also use this method to soften up the calves, which sometimes become swollen as well. And what you would do is similar thing, just draw up from top to bottom, from distal to proximal, and you can also go in circles as well, and this will help with swelling. Another common place that becomes very tight is just behind the knee, at the back of the knee here. You can also use this method for total hip replacement scars, and again a similar method, just going up and down over the scar, but the hip replacement scar is usually just further up behind the bony point at the side of your hip.